I'm Tom Ford. I'm a British Heart Foundation Research Fellow and I'm currently based at the Golden Jubilee Foundation. The research that we're doing is focusing on patients who suffer from angina, which is the medical term for a heart muscle which is not getting its full blood supply. What Professor Colin Berry and I have been doing is a series of extra tests, and these are performed during an invasive angiogram. So an invasive angiogram is the test that we often perform for patients with angina. And what we've been finding is that these patients have a high burden of abnormalities in the small arteries, but some of them also have an abnormality in the way that the artery moves and functions. And that is often termed vasospastic angina. So that's simply two different types of conditions that can be present when patients have angina, but their angiogram looks normal. The research that we're doing on these patients who have traditionally not been diagnosed with any problem, so their angiogram almost misses the diagnosis, and that's one of the limitations of current tests. So during the patient's first procedure, we can now diagnose disorders of small blood vessels or problems that could be overlooked by the traditional tests. So we are really thrilled that we've got the opportunity to go to Munich and present this at the European Society of Cardiology, and that's the largest cardiology conference in the world. And we're presenting this as a late-breaking science trial which has a linked presentation in the European Heart Journal. Clearly there was a number of different bodies that were involved in allowing this research to happen. The British Heart Foundation funded the study. We are obviously based here at the Golden Jubilee Foundation, and we've got a fantastic infrastructure for performing translational clinical research studies. And finally, we've got scientists at the University of Glasgow that have been closely collaborating with us, as well as clinicians and interventional cardiologists like myself that performed the index procedures.